right, welcome to the first podcast of its kind. We haven't even named it yet. We're gonna fill in here once we do. But I am so excited. My name is Elissa Kalver. I'm the founder of WeGotThis.org and a metastatic breast cancer thriver. And a lot of what we do at We Got This is try to have as many resources and recommendations that we can, in addition to being the first nonprofit gift registry for cancer patients. So something we've added onto our website under our community tab are guides and different ways to learn more things about what you might be going through, either as a patient, a survivor, thriver, or a caregiver, or a parent with cancer. And there's so many layers here. And so we decided that it needed to jump off the page as well. And we wanted to take it over here into a podcast style. And so honored to have our first guest, Dena Goldberg, who, if you follow her, you would know as Dena DNA. Dena, thank you so much for going on this journey with us.
Absolutely. I'm excited.
Awesome. We just uncovered that we live nearby and all this. So I hope that this is one conversation of many ahead. But I've been following around and getting to see, first as a patient myself, and then through kind of all of these years, I'm about 4 years in now, to this cancer world that I didn't know as much before having it myself. And the biggest thing I always get asked is if I'm BRCA positive, if it's genetic, and all these things. So I'm so excited to talk to you. I think that our community is going to benefit so much from this.
Yeah, me too. Me too. Let's dive in.
Let's dive in. So maybe quickly, for those who may not be following you yet, we'll make sure to put in the notes, and you definitely should, to keep up with all this good info. If you don't mind giving just a quick introduction and how you got into what you're doing.
Sure. So I'm Dena Goldberg, like you said, also Dena DNA online. I started my career actually in a breast cancer research lab. Where I was basically growing cell lines from mastectomy tissue, realized that I really wanted that patient care aspect. So I went back to grad school, became a genetic counselor, and I actually wanted to work in pediatric genetics because I have a sister with a chromosome abnormality and grew up, around the disability community. And but then when I was in grad school and then studying for my boards, and because I had that job in the cancer lab, I had this other interest in cancer research just because it was booming and it was so interesting, and there was so many amazing just innovations happening in the field. And so my first job out of grad school was at UCSF in San Francisco at the Cancer Genetics and Prevention Program. And then I also consulted for some labs at the same time, and really just got into this hereditary cancer world, and was seeing patients full time for many years. But what I realized is that outside of my work, no one knew what cancer genetics was, or just genetics in general was, and that it was so accessible, and that it was a normal part of healthcare if you know how to ask for what you need. And so I also have a background in like acting and entertainment and performing, and so I wanted to somehow combine my love of the clinical care and science with performing. And so that's kind of how I created my media brand. And I ended up, when my husband got offered a role and we moved down to Los Angeles, I ended up leaving my clinical work and doing some part-time clinical work, but really focusing on this brand and figuring out how to get more awareness out there, how to provide just more knowledge for the general public so that people could advocate for themselves. And then the pandemic happened. So there was a lot of pivoting, but then it kind of turned into social media because that's where everybody is. And there's so many healthcare providers spreading real information and countering misinformation. So that's kind of where I ended up. And then I realized that I still wanted to see patients. So I founded a private telemedicine practice. So now I can see patients, but also create educational content. And I work with lots of companies and organizations and patient groups to really get their message out there. So that's kind of a little bit on how I am where I am today.
I love it. And I think one, accessibility, right? Love that it's telehealth and anyone can kind of benefit from that. But then also I think that the marketing piece is such a big deal because it's like you can have so many amazing things to offer to patients
Yes.
and other people. But like, if they don't know that it exists, then how are they going to get it? And
100%.
yeah,
And it's a huge issue in science, right? Because scientists are not marketers. And so the people that have the loudest voice in the public are not scientists typically. And so there's this huge disconnect of like what's real and then what's being marketed just in general. So I like to think of myself as having the ability to kind of dip into both worlds and speak both languages, and translate for each other.
I love that. And I'm grateful for that, because it's true that a lot of times the most known or loudest voices aren't necessarily the ones that we should be listening to or listening to all the things from. And so being able to cross that over is amazing. So I'm glad that you had that innovation. I think it's going to be so helpful to our We Got This community and cancer community and their supporters as a whole. Diving in, like, so let's take me as an example, as a patient. I mentioned, like, people always ask, like, are you BRCA positive? Do you have genetic mutation, all these things. Like, I wouldn't even know where I would start to think of like how to utilize you in your practice. So like, could you maybe help give us some examples that we could maybe all relate to?
Sure, sure. So typically when somebody is diagnosed with cancer, they have an oncologist that they work with, right? And ideally their oncologist would offer them genetic testing if they fit the criteria for that genetic testing. Now, I'm going to touch on criteria because there's a lot I have to say about the criteria for testing. But so typically people would get it through an oncologist. However, that doesn't always happen. And so a lot of what I do is kind of educate people on how to ask for the genetic testing. And there's also different types of genetic testing. So there's testing for things like inherited conditions that you were born with that existed when you were just an embryo and that will exist throughout all of your life and are in every cell. And then there's also genetic testing on the tumor to see what treatments would be best for the tumor. So we call that germline, which is the one you were born with, and somatic, which is looking at tumor testing. And so those are two different types of genetic testing. They're both genetic, but they're very different, and they're used for different purposes in the cancer space. And then there's also the preventative testing as well. So because you're born with sometimes these inherited risks, you can test what those risks are before developing a cancer. And ideally that's, what we want. We want somebody to understand their risk before they develop it so that they can either take steps to lower that risk or even prevent it altogether, depending on if that's possible, or catch it very early. So do more screening so that it's caught much earlier. So ideally that, that would be what we would want, but obviously that doesn't always happen. So if we're talking about like, how people usually get to a genetic counselor. There are genetic counselors that work at pretty much every major academic medical center. And then there are also telehealth genetic counselors. So typically, if a physician sees a strong family history, or if an oncologist has a patient that's diagnosed at a young age with a cancer or a more rare type of cancer, then they may be referred to genetics, or they may order genetic testing and then refer them to the genetic counselor. But again, it's not always happening. And a lot of that is because there's so much going on at those oncology appointments when you're getting newly diagnosed that genetics isn't always top of mind for everybody, because the first thing is like, what next, right? And genetics can help us with that what next question, but it's not the first thing everybody thinks of. So there's a lot of different ways to make it to a genetic counselor. That one is the referral, but there's also asking for a referral or self-referring. And so a lot of my patients typically now are patients that have a family history, or someone, a relative that was diagnosed with cancer or another condition that they're worried about their risk. And then they'll come to me for this proactive or preventative type of testing. But when I was at UCSF, I was seeing a lot of people that had a new cancer diagnosis or had survived a cancer and had genetic testing many years ago, but because technology is better now, they wanted updated testing. So those are kind of a lot of the different ways that somebody can end up seeing a genetic counselor.
Amazing. That's so helpful. So I kind of heard like three different main things of like the two different types of genetic testing, like from one's the somatic versus
germline.
Yeah. Germline.
Yeah.
And then the other piece of essentially prevention. So like, Do a lot of people come to you even if they don't have, an illness or cancer or anything like that as well?
Yeah, most of my practice now is proactive. So it's mostly people who have not had an illness yet, but they have a family history, or even in some cases, they just are curious about what things they might be at risk for. Sometimes I'll see people who don't know their family history because they're adopted, they're donor conceived, or their family just doesn't talk about family history and health history. And so they want to understand, they want to use every tool at their disposal to understand what their risks are for different diseases and then how to get ahead of those risks. And so that's where, I come in, is the genetic testing, but also looking at personal family history and doing that risk assessment.
Amazing. That's so helpful. So for anyone listening, I mean, it's really something that everyone could have a benefit from.
Yeah. And here's my theory, because this is not where we are now, but I think this is where a field is going. I do believe that we're going to get to the point where everyone is offered genetic testing at a young age so that they understand their risks, that their personal health risks early on, and they could take steps to lower those risks before, they're diagnosed, or like I said, they can take steps to screen to be diagnosed very early. So, I think everyone will be offered that test, but we're not there yet for a lot of different reasons. But we do have that technology. And so my kind of goal is to make that technology as accessible as possible to the people who want it and are willing to, pursue it. And so I think, like I said, we're getting to that place. There are some hospital systems that are doing this what's called population testing. So it doesn't matter if you meet a criteria or not, or it doesn't matter what your family history is or your personal history, everybody just gets tested. But most places are still doing these criteria-based testing. And what that means is that you have to fit your insurance criteria to get testing covered. And so something I like to tell everybody, because this is so mind-blowing for most people, is that genetic testing with an extensive panel out of pocket right now is $250 if you don't go through insurance, which is much cheaper than what people assume. They always assume it's thousands of dollars.
That was going to be my question.
Yeah, but it's $250 if we do cash pay. But oftentimes we can get it covered, especially like if somebody has a personal cancer history, especially at a young age. There's lots of ways to get the insurance to cover it, but if they can't, then that $250 rate, is pretty reasonable. And then if that's too much for somebody, there's financial aid at almost every laboratory. And so I believe that, cost should never be a barrier, and lack of knowledge of family history shouldn't be a barrier. So that's why I offer everybody that wants testing.
I love that. And that's so helpful on so many different levels. For one, kind of going back to the prevention piece, is, a lot in today's information that's kind of put out there. Everything is presented in a lot of ways as a one size fits all, not by not from science driven stuff, but maybe more from the pseudoscience driven things. And there's some stuff that seem, obvious, like that it should be healthy or not for everyone. But there's certain elements, right, to these aspects that, like, there's types of foods and other things that can activate certain cancers or diseases or other things, and some people that wouldn't in others. And we don't know that unless we have more information on us, right? I always kind of tell this joke. It's a real story, but I find it funny. Of when I was first diagnosed with cancer and I posted on Instagram about it, my diagnosis, I got a message within like the same 2 minutes. And one was from someone telling me that I needed to go vegan. And then the other one was from someone telling me I needed to go carnivore. And it stuck with me so much because, one, if you do both, you will literally starve to death.
Yeah. But they're like the opposite of each other. Yeah.
Yeah. But that's not to say that certain diets aren't the right things for different people. And like the people who sent me that genuinely are having a great experience with the diets that they're using. And so that to me always stuck in my head of like, it's not that some of these things are blanket bad or blanketed good. It's that like we just don't know, right? Like we don't know what would be best for us unless we have more data behind it.
Yeah, and when we talk about diets and lifestyle, definitely there are like exercise we know lowers risk of a lot of different health issues, right? But that doesn't mean you can't get those issues, especially if you have an inherited mutation or what we call a pathogenic variant or a single gene change in a gene that would increase your risk for a certain disease. Then you can live the healthiest lifestyle in the world and still develop that disease, right? And so that's why like knowing your genetic background is so important, because you, like I said, you can lower that risk, but you can't ever eliminate that risk. And that really goes for every disease in every person, but we know, that some people have a lower risk and some people have a higher risk. So if you focus on things that can help lower the risks that you're higher at risk for, right? Then that's what the whole idea of proactive, medicine and preventative medicine is, and just like intervening and having better lifestyle habits. But there's so many pieces to that puzzle. So to just tell you like, eat this diet and then you won't, like, it'll cure you or whatever is just so, just crazy. Like,
yeah, it just can't possibly be true. But, so I guess, so the initial thing, even I went initially to like diet and exercise, but what are some other things that like, because that's kind of pushed down our throats, right? Like from so much, especially in social media, but what are maybe some other like lifestyle factors you might not think of that we might be able to tweak or change depending on this knowledge?
Yeah, so definitely avoiding tobacco. Like there is a lot of research on how tobacco can be carcinogenic. And certain types of chemical exposures, usually like very specific to very specific occupations. And honestly, a lot of the lifestyle and exposures that we know of are either very difficult to study, so it's really hard to know what exactly they cause, but there's some that are very obvious. And then there's still a lot out there that we don't know about. But I guess what we do know, I know you're saying it's kind of shoved down our throats, the diet and exercise thing, but I think that's the thing that just keeps getting shown with so much evidence that is helpful in lowering risk for everything. And I'm trying to think what else I usually tell people. Oh, and then like safe sun practices is really helpful, especially for skin cancer. So that's something that is actually very, very helpful to obviously avoid tanning beds, to wear sunscreen, to wear UV protective clothing, especially if you're at a higher risk for skin cancer because of your skin type, your family history, your genetics. Those types of behaviors are very helpful, and skin cancer is very, very, very common. And so it's one of those that you can really work on lowering the risk for. And then also getting your pap smears and even doing something like a HPV shot vaccines, so that you can avoid getting an HPV infection, which can then turn to cervical cancer. So that's another lifestyle modification that you can make to prevent a cancer. So those are general ones, and that's for everybody. Those recommendations are truly for everyone. Well, anyone who has a cervix, I should say, and skin. Well, skin one is for everyone.
Sure.
But then we have things that are more personalized lifestyle recommendations. So like if somebody has a high risk for breast cancer, we're going to recommend that they have their breast tissue imaged more often and earlier than somebody who's at more of an average risk for breast cancer. If somebody has a higher risk for colon cancer, we're going to recommend colonoscopies at an earlier and more frequent basis. And that is really helpful because most colon cancers stem from polyps. So if you do a colonoscopy, it removes the polyps at the same time as it's going in there. And so it's removing this precancerous lesion before it has the chance to become cancer. So colonoscopy is prevention and screening at the same time. So there's a lot of these different interventions based on your risks, but whether it's family history or genetic risks, that I would argue are kind of lifestyle, because they're not like, exercise, but it's something you can do, something that you have control over that can then lower your risk, or at least make sure that if they catch something, it's much earlier.
That's great. And I think bringing attention to the fact that there are so many things that we don't have control over, we just don't know yet. And it's hard because we want so badly to have answers, and I
Hmm.
totally get that and empathize with that. But it can be really hard as someone who, when you're diagnosed with something or different conditions, and not to think of like blaming yourself or thinking of
Yes.
scenarios that you did. And like you said, I mean, there's certain things where you just, you could do everything, have the healthiest lifestyle ever. I mean, I had a teacher in high school who was a daily runner, great shape, and one day had a heart attack. And,
Yeah.
he had some kind of, it was out of his control. But, if he had been overweight or other things that seem more stereotypical of that, we probably wouldn't question it. But
Right.
it's like
Right.
control the controllables, and also be realistic that like we're humans and we don't know everything yet.
Oh, I love that. Control the controllables. That is exactly right. Yes. We don't know everything. We can't control everything, but what we can do is work on the things that are within our control. And sometimes that's more than people realize, right? Like doing these
Totally.
screenings is so within our control, and it's so helpful for, for like I said, prevention or catching something early.
Yeah, and what excited me too is hearing the $250 for the panel, because, especially in the resource directory that we have on wegotthis.org, there are also so many organizations that will help financially with things. So if between insurance, between, financial aid at the clinic itself, like all those steps, depending on where you're located, your type of cancer, what resources, I'd imagine that there are ways to get you that $250 to have this information.
Totally.
But I feel like, and you can probably speak more to this, but that's becoming more of a trend. And maybe it's kind of a bit of a temporary band aid for the fact that it can be really tough with insurance to get certain things covered. Like, I have stage 4 breast cancer. I've been regularly getting PET scans. Then all of a sudden this year they won't cover it. Like they're making me do separated CTs with MRI. And it's just, we're in a bit of an interesting time in world. But what I do think is really promising and brings me comfort, at least, is that there are more and more companies making it affordable to get MRIs or CT scans or mammograms out of pocket. And I even think of that on the mammogram side, because I was diagnosed at 34. I'm about to turn 38. And I mean, there just wouldn't have been any reason for me to get a mammogram. I have no family history of breast cancer. I was under
Mhm.
40, and even before, the threshold I think was 50. So having this knowledge of like, hey, you know what, maybe, I mean, I've heard of mammograms for as little as like a few $100s a year to go get that checked. I mean, that's probably something I would have totally bought into if I could have then. So that's exciting, I think, in different ways. Are there any things maybe in that people should know too? Like, I'm kind of saying in general from what I've heard, but
Yeah, yeah. That's okay. These are great points. So, yes, there are companies that are trying to make it more accessible, but also, if your insurance, so I tell people this all the time, if your insurance isn't covering something that you would like to have, and it's reasonable, because there's obviously some things that are probably unreasonable, like something really invasive that you don't need, but if it's just imaging, oftentimes you can ask for a cash pay rate. And if so it's not going to be crazy expensive for the most part, but I mean it just depends on where you're going, but I always tell people to ask for cash pay rates if your insurance doesn't cover something, because you never know, it may not be that much. So that's one thing, but the other thing is, if you're going to a provider that really understands and works with patients, especially those who are diagnosed with cancer, then we typically can get insurance to cover many things, but it just takes fighting with the insurance company, which is crazy, but it is possible. So sometimes it's like having to like resubmit something or appeal to them, and then it's just a lot of work. And I think there's definitely something very wrong with the system, and I think we're at a point now where there's kind of a tipping point where something has got to give. Yeah, something's got to give right now. But until then, asking for cash pay rates, asking for other options or other companies that are doing it, or even looking up places that are making it more accessible. There's definitely lots of different ways now to get a lot of this different care. And I wish I had more on that, but I think that's
no,
just a
that's super
hack.
helpful.
Yeah.
Yeah.
asking for that.
So then something else I just thought of is in terms of like age of this being appropriate. So like I mentioned, I don't have family history of this particular cancer, and really not a genetic history of like getting cancer at a younger age. And so, when I found that out that I wasn't BRCA positive or things like that, in my head, I was relieved for my daughter and that. But obviously, things can skip generations or other stuff to potentially be wary of, right? Or is there like what age is appropriate
Good question.
to start looking into that?
So when we talk about genetics, things never skip generations. The gene itself, the gene change won't skip a generation, but it can appear to skip generations because whenever you have a genetic variant that puts you at an increased risk for something, it's not 100%. It's very rarely 100% that you will develop that thing, right? Like we just know the risk is higher. And so not every single person with a BRCA mutation is going to develop breast cancer, but we do know that around, up to 80% may. So that's a lot. And that's why we recommend the more aggressive interventions for people who have BRCA mutations, and that's for BRCA1 in particular. That's why we recommend those more interventions, because we don't know who those 80% will be, but that's a lot. Whereas in the general population, it's about 12%. They say 1 in 8, and so it depends on. What was I saying? Sorry. Yeah, can we just cut for a second?
Yeah. It was.
I just lost my train of thought for a second.
No worries. Do that all the time.
I'm wandering real bad. Okay, let's go back. I'm gonna take it back to the skipping.
Yeah.
Okay. So, okay, yeah. So things. The genetic change itself never skips generations, but because everyone's risk it's not going to be 100%, there may be people who have a mutation in a family that don't develop a cancer, and so it can appear to skip generations. But if someone tests negative for one of these genetic variants, then we know they can't pass it on. So when someone's negative, they can't pass it on. But here's the caveat with that. So years ago, people were just tested for BRCA1 and 2, right? Just BRCA1 and 2. I say BRCA, by the way, just because that's how most of us say it, but it's also known as BRCA, the BRCA genes. But that, anyway, years ago, most people were just tested for that if they had breast cancer or a family history. But now we know that there's a huge amount there's over 70 genes associated with different inherited cancer syndromes. And so we recommend larger panels instead of just looking at a few genes. And so if somebody was only tested for BRCA1 and 2, then they may not have had as full of as extensive of an evaluation. And so they may need updated testing, because there are cases where people were negative, but then they went back for testing and they actually had a different higher risk gene that caused their cancer. And so that is something that's really important, because then everyone in the family can then understand if they have that variant and then what their risk is based on that. So I always like to just talk about panels, because panels are really the standard of care now. So if you've had only 2 genes or you've had only a few genes, you can get updated testing to just make sure that, everything is ruled out. And then in another 5-10 years, we're going to have more genes that we know about, and our technology will be better. And so I always tell people who are negative to keep testing over time, because we're learning more and more every year. And okay, so remind me what your original question was.
I forget. I'm pretty sure a lot of it's been answered. That was really helpful going through the panel piece, because I remember I did get a full panel of genetic testing, but I remember them saying that like this needs to be redone, every 4 to 5 years, because we learn more, which makes total sense. And what's interesting too is, I just caught myself saying something like it was fact that I had no idea about, that I was like, oh, it can obviously skip generations. And it's like, where am I even saying that? It's because I heard it like from someone else saying it, and I'm repeating that misinformation, And so I think it's important for me to take ownership of that, but also note that like, a lot of these things, it's not like anything is necessarily just good or bad intentions. Like we kind of learn things and then for us who aren't in that field and in the specialties that you're doing on a day in and day out basis,
Yeah,
like we're not going to have that up to date information. And so I
totally.
think that's what's so important of, whether it's following along with you on Instagram, being a patient of yours, like I totally resonate so much with how important that is. Because, I mean, the way that we find out what needs we have, or, I never thought about genetics and all that really before having cancer.
Yeah.
Um, and so it's one of those things that maybe on a positive side of some of the over influencer pieces of it, it is coming to the forefront in the sense
Hmm.
that I think that there's more of an interest and a desire for us to like know how to be healthier. But then
Yes.
it's,
Yes.
yeah,
I think we're in a generation where people are very focused on living the healthiest that they can and taking as many steps as they can to understand their own bodies. And this is definitely part of it. So I totally agree with you that even though there's all these wellness influencers that are like spreading misinformation or who aren't really truly qualified to be talking about these things, I still think the fact that they're spreading this interest is like the silver lining, I guess, of it, right? And that there are
yeah.
people who really care about becoming healthy or staying healthy or just living as healthy as they possibly can. And then also quality of life, right? We talk all the time about like healthy being like living a longer time, but quality of life is equally as important, if not more important, right? You don't want to live a life where you're feeling sick every day or where you're not able to like enjoy things because of symptoms that you're having. And so that's another thing I think, especially in women, right, who've been so understudied, to be able to have innovations now and a lot more attention to things that improve quality of life is so important. And I think our generation is like super into that, whereas in previous generations it was people weren't really talking as much about it.
I mean, speaking my language now, because, for sure in that piece, I mean, it's one of the biggest reasons why I started We Got This was because I think it's not that one's more important than the other. It's like half the battle is staying alive and making
Hmm.
sure that, we're treating our diseases. But the other half is having a quality life and actually getting to live and thrive.
Yeah.
And it's so easy to lose sight of that, particularly when you're the one on the outside. So before having cancer myself, being, the family member of or the friend of, like, when you hear that something's working, like chemo or something like that, like that's all you think matters. It's like,
Yeah.
well, great, do whatever you have to do. Like, we want you to stay alive, we want you to survive.
Yeah.
And then when you're in it, you reset the bar a bit because you realize that, like, you haven't been thinking about the whole scenario because you weren't living in it. And once you're living in
Yes.
it, there's a
Yeah.
lot more to that. And just because we're technically alive, if we don't get to live our lives and be comfortable and have quality of life, then that's not living. And that's, I don't think, acceptable for us as humans to
Yeah.
settle for.
Yeah. For sure. I 100% agree. And I think also there's a lot of this now. There's a lot of discussion on menopause and how the quality of life for so many years was so low when you would go through that, and people were just throwing things at them that weren't really working, and that's something that like half the population goes through. So how was this not more discussed? But especially in the cancer space with survivorship and a lot of the downstream effects of some of the treatments and everything that you have to go through. There's so much there. And so yeah, I really love that there's what you're doing is also helping people improve the quality of life with products, it sounds like, and that
Yeah, a
that
lot
can
with
be a big
products and
deal.
yeah, exactly. And, I'm always encouraging people, like, in addition to the things that might seem stereotypical to register for, like wigs or barf bags, like, register for the concerts, like, register for your date nights,
Oh,
like,
I love that.
because in treatment, like, again, you don't really realize you're going through it. Like, yeah, you do feel pretty crappy a lot of the time. depends which type of treatment you're on. And a lot of times, like even in the most toxic of chemos I've been in, I might have, those couple weeks where it's like I'm tied up in bed, but then all of a sudden you have those like few days or period of time before that next round where you feel like yourself again. And so we'd really jump on, my husband and I, like making sure that we took advantage of that when we started being able to like predict that timeline more. But I think that validation is so important, like where you brought up early on with advocacy. I think that advocating for ourselves can become so intimidating because we don't always feel validated. And, again, and everything we do is for everyone, but using the example with women and menopause, and I grew up with endometriosis, which, at that time was like, not even now seeing a lot more out of people talking about endometriosis. I'm like, oh yeah, I did always suffer through that too. I don't know, like a lot of things we're kind of told are normal. Yeah. And we kind of feel like are normal. And having that kind of validation and knowing that these things aren't necessarily what we have to suffer through, but then also meeting that with potential solutions, I think is so important. And so I hope, for people who listen and follow, all of our things, like I really hope that people feel empowered to advocate for themselves and to know that there's people out here, like if you have questions on genetics, like they can reach out to you. And,
absolutely, yes.
Yeah. And being in line with your oncology team and all that too. It's funny because where, again, we've brought up a few times on certain things split from science and influencer things. And one example I use a lot, because people will be like, oh, you don't want to only focus on the doctors. Like there's more functional medicine, all this stuff. And it's like, well, my oncologist is connecting me with my acupuncturist. And she's suggesting that I see dietitians. And she, like sometimes we don't have the right doctor. And so it is true that sometimes they won't identify expanding their team or suggesting other recommendations or like knowing where their expertise ends. But I do believe that if you, are able to take the time and are able to, through your situation and insurance, whatever that might look like, find the right care team, a lot of this stuff does integrate together. And you can utilize a lot of things you might be interested in with other supplements and other things, but like, don't just go, rogue and do that. Like let your, because especially the supplement piece, it was really interesting. In my first like 8 rounds of chemo, I did TCHP, and like I would just get Google Docs from people or friends of friends of their like nutrition and what supplements they took. Like, hey, my friend did really great in chemo and like beat their cancer. Here's everything they did. And I mean, that's so dangerous. Like some of the things were like vitamin C supplements, like things you would not do during active chemo or certain things. And even like certain mushroom things, you think, well, that doesn't matter, but there were certain like clinical trials I was in and other stuff that had I taken certain supplements, I could have been kicked out of the trial.
Yeah. Yeah. And also there's like drug interactions, and that doesn't just have to be drugs. It's any substance you put in your body can have an interaction with another substance you put in your body, whether they're natural or not, right? And so, yeah, that's really important. I usually tell people, as long as you're talking to your care team openly about what you're interested in taking, that's what's going to be the best thing, because your care team, so your oncologist or whoever's, taking care of you and treating you, they're going to want to know what you're on. They're going to want to know what you're interested in. And they may say, this isn't for you, but there's a study that shows that this other thing will do the same thing and is safe to take. Or I trust this. Or, we have a study for this substance. And so definitely that open communication is really important. I think in every medical setting, like anytime you're working with 100%. Anybody who's prescribing you medication, they need to know what other medications you're on and what other supplements you're taking and whatever natural substances you're taking, because there really may be that overlap. And they may even want you to like go off of something in order to take a supplement and, temporarily or whatever. So yeah, as long as your care team knows this, there are certainly care teams that will work with you if you're interested in taking, some sort of natural substance or any anything that you may have received in a PDF. But you're right, that's very dangerous, and everybody is going to react differently too to different things. And I hate when people blindly say, oh, you must have this and you should take this supplement without doing any in-depth testing. And with like, it's just, that's crazy to me. So yeah, just make sure your care team knows. That's what I tell people usually.
Yeah, that's great advice. And I say that too with like when you have the right care team, because no one knows all the answers. And my oncologist is the first one to say that. Like, if we knew all the answers, I'd be cured of metastatic breast cancer.
Yeah. Yeah.
But, you know, we have as much of the cutting edge information that we possibly can. And, you know, I'm at a point, and I haven't always been here. There's been parts of this, you know, in my life in general, but like specific with my cancer experience, like where I haven't trusted my oncologist or my doctors 100%, where I've like wanted to continually ask other questions or like maybe get second opinions. And which I think is great. And any good doctor is going to be okay with you getting other opinions.
Yeah.
But, you know, over the past 4 years, getting to this point where like, if I asked about doing something maybe alternative, and I know that my doctor would do as much as she could to like respect and entertain my interest in question. But at the end of the day, if she was like, look, to be honest, like you should not be doing this. And like, there's not enough science behind it. It's not, you know, then like I'm confident enough in who I am being taken care of by to take that at face value. But then also if I wasn't, then that's when you can get other opinions and other things. But I think that it's just such an important piece. Well, circling back on the genetic side, like, I mean, this is all just so much great information. And I think it's really like comforting to understand. I think a lot of times people feel nervous about having more info. Like, well, what if I do have BRCA? And what if I do have this? And then I have to make these decisions. And it's like, I think that we should be empowered by the fact that we can find out a lot of these things in a relatively low cost, maybe even free way, and have solutions to like stay on top of it and be educated
absolutely.
on it.
And some of them are really, I mean, I didn't mention this earlier when you asked about lifestyle. There's some conditions that will have very easy and simple just tweaks that you can do to lower risk. So an example is in Lynch syndrome, which is actually the most common hereditary cancer syndrome. It's more common than BRCA. It's just not as well known because there's not a celebrity that's come out and talk about it. We know that taking certain doses of aspirin actually lower the several of the cancer risks. And so we call that aspirin therapy for people with Lynch syndrome, but it's only going to be recommended specifically for people that aren't prone to like GI bleeds and in certain situations. So it's very specific to like your situation, but there's a lot of great evidence that people who have this inherited cancer syndrome can lower their risks simply by taking a pill every day. And it's a very, benign thing. So they're working on figuring out the dose, but that's an example of the more people are able to understand that they have these syndromes, the more research we can do and the more we can find interventions that are very benign, comparatively, that can lower risk for cancer. So that's another thing.
I love that example. I love that example for two reasons. One, like you were saying, if you have the information, there's actually a really easy, way to potentially treat that. But then also, you're not saying that everyone should start taking aspirin every day. Yeah. You're saying that, like, if you're tested positive for this particular mutation, and it's like...
Yes, and you don't have any contraindications, then yes, exactly. Yeah. Again, this is why medicine needs to be personalized, right? There's no blanket statements in healthcare besides the, exercise. But even at that point, I mean, there's some people that will have a genetic condition where actually exercise might be bad for them, a certain type of exercise. So it really is very personal. Like anything is personal. The only thing I could think of that works for everyone is the tobacco, because there's nobody that tobacco is good for.
Yeah.
But yeah, so that's, I think, knowing your risk, there's so many things you can do to get ahead of it. And that's not just cancer. Amazing. That's a lot of different conditions. So heart conditions, and then there's blood conditions, there's kidney and eye conditions and hearing, and their genetics is really, it's so complex, and there's genetic counselors that work in so many different subspecialties of medicine now. But cancer really is the big one, where we have it's one of the biggest categories of genetic counseling, just because there is so much innovation, and we know that really all cancer comes from a cell having a number of gene changes that turn it into a cancer. And so we're trying to figure out why, and what we can do, and how we can base someone's medical care off those genetic changes and really personalize it to their tumor and to their disease. So that's why, there's a lot of really cool innovation right now in genetics.
That's great. That's awesome. Well, this is all such great info. Is there anything that is kind of like additional advice, or what kind of stands out most that everyone listening should know about?
Yeah, I think the biggest thing is, if you've had cancer, I think at all, you may or may not fit your insurance criteria for testing, but there are still people that don't fit criteria that come back positive. And then if you come back positive, there are things we can recommend for you. So I truly do believe that everybody that wants genetic testing should be offered it, especially anyone who's had a cancer diagnosis. There are so many situations where we truly don't know our family history, or maybe... Oh, then the other thing when we were talking about skipping generations, that I wanted to come back to, was that a lot of times in some of these cancer syndromes that are more like female cancer centered, there are males in a family who will have a genetic mutation but not develop cancer, because their risk is much lower than a female carrier, like in BRCA. And so you can have it go through multiple males, and then once they have a daughter, that daughter develops cancer. And so a lot of people think you can only get it from your mom's side, but you can get it from either side. It does not matter which side. So that's another thing to know, is that someone may not have a family history, but then they actually have a high risk mutation that they just wouldn't have seen because of how it got to them. The other thing too is there are certain ancestry groups where the risk is higher. So for instance, if someone's an Ashkenazi Jew, so they're Jewish of European origin, that they have a 10 times higher rate of having a BRCA mutation. And so one of the recommendations now is that everybody with Ashkenazi Jewish ancestry, even one grandparent, should be offered testing for BRCA. And really there's some other cancer genes that are common. They're called founder mutations. So there's specific variations common in the Jewish community that should also be tested. So I just recommend everybody do a panel. But then there's also in the Black community, there's actually higher rates of BRCA than people of general European ancestry. So different ancestry groups may have different prevalences of these cancer genes. And when they're less studied, there's not as much awareness there. So again, another reason I'm all for population screening, where everybody just gets offered a broad panel. But until that point, I think I like to tell people to ask for this, or to seek the testing if it's something they're interested in, and just continue kind of reevaluating every 5 to 10 years and looking at genetics again, and really just getting a risk assessment in general to really understand what you in particular may be at risk for. So that's, I guess, my last point. And also the other thing I wanted to mention is a lot of people ask how to find a genetic counselor. So there's a website called findageneticcounselor.com. So pretty simple. And you can find one near you. Most of them will take insurance. I also have my telemedicine practice. I'm one of the only ones that doesn't take insurance, but I have very affordable out-of-pocket prices, and also can submit a super bill. But so you can find a genetic counselor. You can use me if you're in a state that I can help you with. Or there's also a company called JScreen that offers both a cancer panel as well as carrier screening. And I think they're really good for people who may not fit their insurance criteria, because it's a subsidized test, and they actually offer a genetic counselor that will give you your results. It's part of the price of the test. And so it's a way to order it for yourself instead of going in and getting a full evaluation. Although I do prefer that. That would be my number one, is to recommend that people get a full evaluation. If you have any other questions, I do have a post on my Instagram. It's a carousel post, and it says how to get cancer genetic testing. And I have a lot of resources there. There's more resources as well. And there's sponsored programs and stuff. So so follow me, DM me on Instagram. That's actually where I'm the most responsive. But
give us all the handles and stuff. How does
So
on
Instagram, it's Dena.DNA. So that's DENA. .DNA, and then on TikTok it's just Dena DNA, one word, no dot. And then those are the two places I'm most active. I'm trying to do more on YouTube and LinkedIn, but those are the Instagram and TikTok are my biggest right now.
Yeah, amazing. And if people want to reach out to you to see if you're covered in their state and all that, is the best way to message you there, or what would you recommend?
Yeah. Yes, you can go so my clinic is called Malibu Genetics. So it's malibugenetics.com, and you click on become a patient, and then you'll fill out just like your name and state. And if you're in a state I can see you in, then you can continue. And if not, it'll give you a little message. And then at that point, if I can't see you, you can, go to findageneticcounselor.com. There's also if you're in LA, although I'm sure people are kind of all over, but there's different major medical centers in every city that have genetic counselors that are very good, that will do a full evaluation. I do recommend going through somebody where you can actually sit down and have a visit, whether it's telehealth, video, or in person, rather than just ordering a test if you do have a family history or personal history, because if you just have your physician order a genetic test, they may not be doing the full risk assessment that you can get with a genetic counselor. So I do recommend seeing a genetic counselor before testing if possible. But again, if all you want is a test and you just want to get that done, then there's those resources that I've provided on my Instagram.
This is so helpful. And my biggest takeaway is really that if someone wants genetic testing, which I highly believe that they should, there's just so many ways to get it. It's really not a high barrier to entry, or as high as it may have seemed. So definitely check out all of Dena's things and any resources and anything that can be helpful. We'll add some of that on wegotthis.org. We'll probably have to do some kind of collab post too, make sure our whole community knows it as well. But thank you so much for your time and all that you do. This is just so important, and I'm so glad that you chose this focus while having such a great personality and marketing mind, so that people can actually know that it's important and exists.
Yeah. Oh, and last thing I just want to mention, that I know this can be really scary, but it doesn't have to be as scary if you have somebody that is helping you through it, right? Which is one of the benefits of working with a genetic counselor. And I think a lot of people are worried and they have a lot of anxiety. But what I find is that when people do test, whether they're positive or negative, if they're negative, obviously they're going to have, for the most part, they may have less anxiety. But a lot of times if they're positive, knowing what they have and then what that means and what a good solid plan is going forward gives people this sense of control that then lowers their anxiety. So for people who are really anxious to test, who are worried about it, that's something to think about. And then the other last thing I'll mention, because I forgot to mention this, people are often worried about privacy in genetics and where your data is going. And at these medical testing companies, it is very private. It's the same as if you were to get a blood test, at a hospital. It's covered by the same HIPAA laws. And there are laws at both the state and federal level that protect people against genetic discrimination. So if you haven't been diagnosed with something, but you have a genetic risk for it, these laws prohibit health insurance and employers from discriminating against somebody. It doesn't cover life insurance, so that's something that I do talk, or disability or long-term care. I do talk to patients about that, but I did want to just throw that in there so that people understand, that there's lots of protections in place if they're worried about privacy.
That's great. I think that's so important for people to know. So thank you for adding that in.
Yeah. I'm thinking about all the things I usually talk about. Oh, I forgot to say this. Yeah. Oh, okay. Yeah. Sorry. I have one more thing to add.
No, let's go.
This is something that everybody always says. So if you've had 23andMe, you have not had cancer testing, cancer genetic testing. That is only looking at very specific bookmarks. It's not full sequencing. So that's another question I get from most people is, well, I already had BRCA testing, but you didn't if you just had 23andMe. So you need a medical grade test. I had to throw that in there.
That makes sense. Just like how there's certain scans or things that you can have that are maybe more of a broader look, whereas well, if there's anything else you think of, I'll follow up with information on the guides that we have on our community page. And I think it would be great to maybe summarize a lot of stuff there so people can pull it and have kind of an easy reference. I think it's also great that between this conversation and maybe a post we can do in that, it's an easy way to forward that to a family member or a friend and make sure to kind of spread the word on this, because it's something that there's really no reason why we should all be benefiting from. Well, this is so important and so helpful. If anyone does have more questions or things that they want to hear more of in these conversations that we're starting to do, definitely feel free to email us at team@wegotthis.org. And we'll take a look, and we can always post some additional answers or questions. And if you have anyone that you think we should be getting on here to spread knowledge like Dena just did, please let us know. But this is great. Thank you for helping us kick off this series, and it's going to help so many people. Really
absolutely. I'm glad that you're bearing with me. I had lots to share today, so I'm glad
it's great. We're both, honestly, this is totally improvised, and I think it was flawless, so thank you.
Good.
And
Good.
Katie, shout out to our social media manager, Katie, who helped walk us through it. So thank you so much.
Amazing. Well, it was so great to meet you, and I look forward to doing more.
Yes.
We got this.